the interest from all of you for joining us. It's also been really great to see the interest from the media in the latest report that we have released. This one has got a huge amount of attention, and we think for good reasons. So thanks again for all your interest in it. I'd like to start, if I could, by acknowledging the traditional custodians of the lands on which we meet today, albeit virtually. I'm joining you from Western Australia on the lands of the Whadjuk people of the Noongar Nation, and I pay my respects to elders past and present. So look, before I introduce our panel, allow me to give you a little bit of background into the Australian Healthcare Index. So this is the 6th iteration of the report. It's a really fantastic collaboration, we think at least, between Healthengine and the Australian Patients Association. And over the last few years, I think this report has become, I guess, a bit of a temperature check and a pretty essential one on how Australians are feeling about the healthcare industry more broadly. And I think a really significant contribution to the national conversation, which we're hoping to continue with today. Healthengine as a company, by the way, has about 10,000 primary healthcare practitioners on our platform. And I think, we witness the industry and practitioners doing a pretty good job of making their voices heard in Canberra and the like, as they should. But we see less opportunity for patients to get their voice out there, which is the reason why, or one of the main reasons why we've commissioned this report and partnered with the Australian Patients Association. So we surveyed over 9,000 patients for this report, and those participants were weighted to be representative of the Australian population, be that based on gender, income level, cultural background and the like. And our plan today, I guess, is to highlight some of the key findings of the report, but also, I guess, to bring out some of the insights from it with a panel of experts. So I might start by perhaps introducing that panel of experts. I probably should have said this at the start, by the way. I'm the CEO of Healthengine. I'll be, chairing the conversation, but you'll be much more interested in hearing from the panel. Jodie Guerrero is a patient, a triple blood cancer survivor with a pretty inspiring story, I've got to say, and now a patient advocate who will be giving us her perspective. Dr. Amandeep Hansra is, she wears many hats, but is Healthengine's medical advisor for one, probably the job that's most important to me at least, but she's also a practicing GP in Bondi in Sydney, and has been involved in various healthcare companies over the years. And then finally, David Clarke, my partner in crime, the CEO of the Australian Patients Association, someone who I've worked closely with him and his team. His team does a huge and really amazing job in coming up with the questions to ask the patients and then getting the messages out there to the general public. So thanks to all of you for joining. I'll kick off. I'm going to bring up a few slides, but I promise it won't be death by PowerPoint for everyone. I'll just bring up a slide and highlight a key stat, and then we can get that back down and talk about it. But I'll start with this one, if I could, and that is Australia's declining healthcare rating. So you can see here, Australians started when we first started doing this report. The rating out of 10 was 7.8, which was a pretty good score. And we've seen a consistent decline in that score, where it's got down now to about 7 out of 10, or exactly 7 out of 10, I should say. Look, it's still not a bad score in the grand scheme of things, but it is a pretty concerning trend if it keeps going in this direction. So Jodie, I might start with you, if you don't mind. Perhaps can you start by just giving a bit of an overview of your healthcare journey and I guess why you think Australians are marking our healthcare system down?
Well, so my name's Jodie Guerrero from jodiesjourney.com. So I have been on a journey, a very difficult healthcare journey for a long time. Back in 2006, was diagnosed with a very bad end-stage disease and incurable, according to the doctors, and went through a disease called non-Hodgkin's lymphoma. I was basically 7 doctors, 21 different times told me that there was nothing wrong with me. Ended up going to a very big emergency room, and that room, one of the doctors there basically saved my life. I was about 3 months away from death, and I had huge amounts of disease eating into muscles, nerves, tissues all through my body. And so this is what happens, unfortunately, to a lot of people. Symptoms just don't get checked very often or don't get checked the way they should be. And so what I try to do now is I try to advocate for patients. After that particular problem, I went through another stage of cancer where it went away and it came back again with treatment. And after that, I ended up having a bone marrow transplant. So I actually have two sets of DNA. I have my own DNA from my parents and my DNA from a donor in the United States. And my blood type changed from O positive to A negative. So I have had 93 doses of chemo and radiation, and I take 52 tablets a day. So from
Wow.
my particular difficult thing that I've been through, I want to use my experiences to help people. And there are a lot of things I see in the front line, talking to patients every day when I go to my appointments or talking to patients online. There are a lot of things that we can learn to help each other. So that's what I'm here for.
And is there anything in specific that you could point to based on what you've gone through, the reasons why the healthcare system might be trending down from your perspective?
So often what I hear from patients firsthand is that there's this fear and embarrassment about where they are, either financially or medically, and they don't want to tell their GP or their doctor the real truth about how they're struggling. And I know that everyone deals with fear and embarrassment in different ways, but I want to encourage patients to please speak to their doctor and be honest with their doctor about what they're struggling with. Often the doctor can give a patient a cheaper medication, or they can talk to their pharmacist about, sort of spacing out payments. And this is something that I think a lot of patients really have difficulty with, is just talking about the reality of their lives and how they're struggling with finance and other things too.
And Dave, I might bring you in now. Is that consistent with what you see with your organisation? What's your take on this?
Well, yeah, I think the index has some of the answers and what we're about to talk about. And as we pull the report apart, we're going to see what's really concerning people. Jodie mentioned financial fear, and I think this index is more than any other, I think, an indication of the increasing financial problems people are facing in order to simply get basic healthcare. And I think that's, for me, it's probably the biggest takeout of all. There's all sorts of ongoing issues with quality, but affordability is impacting accessibility of the healthcare system to a really serious degree now. And there's going to be downstream impacts of that I hope we get to discuss today.
And that is, in fact, the next stat that we're going to be talking about. But before I move on to that, Amandeep, from the front line as a GP, what's your take on it? What are you hearing from patients?
Yeah, look, I mean, it's really sad to see that number sort of declining. Obviously, as a practitioner, healthcare practitioner, I've been doing this for nearly 20 years. Providing good quality care for all of my patients is really, what I came in to do when I entered healthcare. But I think there's a lot of external factors that are influencing some of the access and experience of patients, which David kind of mentioned. Affordability is definitely one of them. I think also accessibility. We know that people are having more trouble getting into their GP than usual. We do have some workforce issues to sort of overcome as well. I think also generally we're having patients with more complex conditions coming to see us. Obviously, with a chronic disease increasing and an aging population, care has become more complicated for us to deliver, and with that comes a flow-on effect of we can't see as many patients if we're trying to deliver really good care to an individual patient who has quite a few things wrong with them, and then it flows on to not having that availability for others. And obviously one of the solutions is to bring more clinicians into the system to help support that, but we also need to think about how we can do work smarter and not just solve every problem with bringing more people in. But I think it's also, I'd be interested to know sort of the COVID effect of some of those numbers, because some of those earlier numbers were done obviously during the COVID period, when there was a huge focus and shift and resource intensive period of everything being poured into healthcare. And we're experiencing some of the post-COVID effect, I think, still, with some of our healthcare practitioners still quite burnt out. People have reduced some of their hours or have left the system. And then we've also got a backlog of things that we probably didn't do during COVID very well, which was keeping up with general screening, making sure we were focusing on preventative care because we were very reactive at the time. So I think there's a combination of things that I think might be influencing that number. But I do think it's, broader than just, one singular issue that we can say, okay, that's what's bringing that number down. But certainly the experience of patients, is demonstrated is not ideal at the moment.
Just pick up on one point you mentioned there before we move on to the next stat. We're hearing consistently from doctors that there just aren't enough of you out there still, and that's become particularly acute since COVID. Is that subsiding, or is that still as significant a problem from your perspective?
Look, I think what we are doing is looking at what do we actually do day to day, and are there things that we don't need to be doing? So, for example, are there things that your multidisciplinary team could be delivering? And I think it's definitely utilizing the team-based care better. So it's not constantly a GP-led model all the time, where there are other healthcare practitioners in the system who can do certain tasks that help, but also how can we improve other, sort of non-clinical tasks that we're doing to help, sort of the back office, the back end stuff, so that we're not spending a lot of our time doing admin or the logistics side of it. We're actually there delivering care. I think the more time we have freed up to actually sit with our patients and spend time on patient care, then that's going to lead to better resourcing across the whole system. So I think those are some of the things that we really need to focus on, is making sure that we're all working, using the best potential of the skills that we have.
Yeah, and technology obviously has got a pretty big role to play there, something which obviously we're quite focused on at Healthengine as well. We'll probably come back to some of those things a bit later on, but Dave, I might just pull up this stat now for your comments. So look, as everyone can see there, the cost of living impact is that 3 or 4 out of every Australian is delaying a visit to their GP or their dentist, or sometimes not purchasing medicines that they require. And of those people, I think 60% of them are choosing to delay a visit to their GP or dentist in order to make ends meet. Dave, what's your take on this? You touched on this earlier. It's obviously a pretty concerning trend.
Yes, and I do want to clarify, I don't think it's the only issue. It's just that it's becoming a huge elephant in the room now in terms of its impact on the overall system. And I think that statistic tells us an awful lot. On the accessibility issue, though, just briefly on what Amandeep was saying, I'd agree that it's increasingly difficult. Patients report to us it's increasingly difficult to get a regular doctor. One of the really severe impacts on that is get a regular doctor that you don't have to pay to see. In other words, you can get bulk billing access to, and we can talk about that a little bit later. But what you have, when you have a statistic that tells you half of Australians are delaying or not attending a GP when they feel they need one, is they're actually stepping away from primary care. And a proportion of those people, and in huge numbers, and a proportion of those people, it's as if we've fallen off a cliff and we don't know it yet, because those people are going to, in some proportion, be turning up later, less well, and some turning up to already crowded emergency departments, which we'll touch on a little bit later. But that has an overall really significant long-term impact on population health. And that's something that I find it very, very difficult from an Australian Patients Association perspective to get past and talk about even some of the other issues, because it's such a severe potential impact. I think we should all be very, very concerned about that. And certainly there's an important call to action in that for the Patients Association to try to socialise this issue a little bit more openly, and to talk about key players in the healthcare sector and governments about the problems that are coming from people making choices not to receive healthcare for financial reasons. And as was touched on earlier, that what the report also shows is that whilst this does have an impact on lower income earners, and we really need to focus on the deep impacts there, because there's a lot of correlation between people being less well and on lower incomes. But it's also affecting people because of the other cost of living pressures we're all facing. It's also affecting people in higher income brackets as well now, that it had so healthcare has become discretionary. And not a fundamental thing that people go, I need to see the doctor, I'm not well and I need to find out how to get better. I need to get support and engagement and have a quality healthcare experience. They're simply saying, can't afford it right now. It's a big problem.
Yeah, so Jodie, I might bring you in now. Obviously, what you described with your healthcare journey has been a pretty harrowing one. I imagine cost must have been a factor through all of this. What can you tell us?
Back in 2006, when I was diagnosed, cost was not as an issue as it is now. So, but I know from being having a delayed diagnosis, that when you push things back like that, your disease not only gets worse and it impacts your whole body, it starts to, to impact parts of your body that you're not aware of, and also it causes so much serious problems inside your body. You have issues with your disease speeds up. So actually what happened with me is I had lymphoma, non-Hodgkin's lymphoma, and it sped up to a point where it was just taking over everything, so inside. So this is a major problem with people who are taking medical things into their own hands. They're saying, well, I can wait, a couple of weeks, I can wait a couple of months, or, I don't have the money or whatever. And this is what will cause your disease to get worse and worse. And you'll find that it's not a very good outcome for you. So I encourage all patients to not think about finance first. If they have to borrow money. If you have to go to your doctor, it's the most important thing is to see your doctor straight away if you have any sus symptoms. And this is really important for patients.
It's interesting that you raise that, actually, Jodie. We see this ourselves on Healthengine. In fact, there's a greater proportion of patients now that are electing to pay with credit cards or with payment plans than what there was even a few years ago. And we're also seeing a trend of more providers, be that GPs or dentists or even physios and chiros who are publishing their rates and publishing what it costs for a consultation or a cleaner scale for a dentist or what have you, because patients are demanding that so much more now, which I guess is a good thing. I mean, you want that the more transparency there is, that the better it is for patients to be able to choose services that they can afford. But I absolutely take your point. It's delaying healthcare should be the last option, not the first to try and make ends meet.
It's very scary to have patients saying, I'm not going to, I've got pain, but I'm not going to address it because my mortgage is more important, or the food that I put on the table is more important. And of course, there are people who have to do that. You have to give food to your kids, but you also, I think a lot of patients don't realise that there are a lot of options for them, particularly in regards to things like the safety net for their medications. There are probably people who are not taking advantage of some things that the government offers. So I really ask patients out there who are listening to make sure that they look at all their options and don't put off going to the doctor. It's the worst thing you can possibly do.
And Amandeep, just before we move on, I mean, are you seeing this? Are you seeing this with your regulars, that people aren't coming to see you as often as they would?
Look, I think what I'm finding is people are saving up shopping lists, I call them, where they come to see me and they're like, I've got 10 things I've been waiting, to come in, in one go and talk to you about this. I mean, one of them is obviously time and accessibility, but it's also cost, because then I pay once. It is a challenge. And look, as healthcare practitioners, I mean, we didn't sort of get into healthcare to have conversations around money. Unfortunately, that wasn't really part of what we signed up for. I think it's really hard. Many of us are very altruistic and want to be able to provide care, but obviously the pressures of cost of living are on practices as well, where they also have increased costs of delivering care, whether that's medical supplies, rent, staff costs. And so the sustainability of primary care, has a flow-on effect to patients, because obviously if the practices can't remain open and financially sustainable, many of them are small businesses, it makes it difficult for them to provide really good care. And, anecdotally, we're starting to see that a lot of GPs are actually preferring sort of salaried models, like going and working for healthcare organizations where they don't have to worry about, billing and percentage of billing and worrying about how many patients they're seeing, that they can just provide really good care, which is what we all really want to do. I think it's just this pressure of the model that we have, where we've got to see as many people as we can to maintain a certain level of covering the costs of the practice and covering all the things that we have to pay for as well, like our indemnity, insurance, CPD, registration with colleges, etc. So it's a difficult situation, I think, for everyone and all the stakeholders. But we do know investing in primary care is really important, and exactly what David said, and Jodie's touched on as well, that if you invest money into preventing and primary care and early intervention, you're going to save that money in preventing avoidable hospital admissions. I think one of the reports from the AMA last year, they were saying that if we invested in primary care for Australians over the age of 65 and those in aged care, that we would save about $20 billion over 4 years through preventing hospital admissions. So primary care is really like the foundation and bedrock of really good practice, really good healthcare practice. And I think we do need to, there's an education piece about understanding its role and its value, and certainly having enough resources to deliver, high quality, good quality primary care.
Yeah, it's been interesting, actually. That's one of the main topics that's been picked up since we released the report a couple of weeks ago, is just, GPs in particular and people that are working in the industry, just making the point that the more that this trend continues, the bigger pressure we're going to be placing on the hospital system and emergency departments and the like, which is unplanned, but a useful segue to perhaps the next statistic that I want to talk about. And Dave, I think I'll throw to you here, but the access to healthcare is becoming inequitable. So as you can see here, the emergency department presentations have increased from 26% of people that we surveyed a few years ago to now 31%. And there's some interesting reasons for that, which I'm sure you'd like to expand on. But we're also seeing, as I think has been well documented, we're also seeing that the number of people who are waiting for elective surgery is also going up pretty substantially as well. It's at 10% to 12%. Now, on the face of it, you go, that's only a 2% increase, but overall, that's a 20% increase in the people that have been surveyed over the last few years. So if that trend continues, we're going to see really long wait lists, and we're going to end up in a really difficult circumstance. So what's your take, Dave? Why is this happening?
Well, there's 2 or 3 things in there, maybe 4 or 5. The emergency department issue has been an issue for a long time, and it's continued to trend upwards. There have been efforts by government in the creation, for example, of urgent care centres to try to deal with people who don't necessarily need urgent care, but need access to free healthcare. It's in some ways it's an attempted taking pressure off of emergency departments that's not necessarily addressing the underlying issue, which is a big problem. And I noticed one of the questions in the Q&A goes to this, which is, why is bulk billing less and less available at the moment? And we've kind of talked around that already a little bit, and that probably goes back, if you want to look at where the graph started really significantly changing, was under the previous Liberal government's 8 years of freezing the Medicare rebate. Simply took the relationship between the funds provided to a GP or a GP practice to conduct a consultation, a medical consultation with a patient. It took the relationship between the real cost of that and the Medicare rebate completely away and out of reality. So, the ability for GP practices to provide bulk billing care is dependent on what the relationship between that bulk bill that they can send to government and receive a rebate for and the real cost of delivering care. There's no relationship between those two anymore. I'm almost very impressed that some practices are able to deliver bulk billing. All of that pushes itself into the emergency care issue and makes that worse and worse over time. Now, what was the other one there? Could you just pull that slide up again?
Sure. The elective surgery piece is, I guess, again, not a surprising one, but
that's right. Elective surgery is one of those issues that it's a squeaky wheel. It's like aspects of emergency departments, but elective surgery waiting lists are the sorts of things that demand short-term urgent action by governments. And so when they get close to completely untenable, there's a tendency to make emergency investment in them without necessarily trying to address and resolve in the long term the underlying problems. And elective surgery has continued for various reasons to be blowing out. Now, what that really calls to is the issue around private healthcare and private insurance. So half of Australians are privately insured, and we're talking about elective surgery in the public system largely here. So ironically, private insurance becomes attractive when the public system's not working properly. And in some ways, that's why half of why private insurance is doing relatively well, and why half Australians are privately insured.
Although, just sorry to drop over, but just pick up on that point. I mean, the survey did show that, to your point, private health insurance coverage is relatively stable, but the satisfaction with it, and primarily around costs, has been declining very rapidly. And a lot of middle-class people are also struggling to be able to afford that now, and it ultimately, I think, is going to place more pressure on what we're talking about earlier.
And one of the really important ways that private insurance is used, of course, is for hospital stays and operations. We have a situation in this country where billions of dollars are provided to specialists, and yet a person who is privately insured, fully privately insured, and requires an operation can sometimes get lumbered with costs of thousands of dollars. In fact, we're dealing with cases of that nature right now. Sometimes they're not properly informed, so they're not giving informed financial consent. You can't give informed financial consent when you have to wait until you're in the consulting room making an appointment for the operation to be told what it's going to cost, because you're already tied into it and concerned and fearful. Then there are unexpected future fees, sometimes not provided. So there's a transparency problem, there's an informed financial consent problem, and there's a fundamental problem where health insurance is not buying you full coverage. Even though you're buying full coverage, it's not full coverage. Those sort of gap payments are a really severe problem. Specialists are unregulated and claim a sovereign right to charge what they want. That's okay, but they're given billions of dollars a year to do what they do. And there needs to be some accountability and controls placed on that. At the very least, much greater transparency and accountability so that patients know what they're up for if they're going into an operation.
Yeah, and we've had a question actually, which is broadly related to this, which for you, Jodie, which I might get you to address. So someone has asked, or Raphael, I should say, has asked, is treatment for your cancer one of the cancer treatments that was previously publicly funded and is not anymore? And what can you tell us about these statistics?
So my particular cancer, blood cancers, are very, very dangerous. Lymphoma and leukemia are those type of cancers that have to be treated immediately. So my cancers have the cancer that I had has always been treated, has never been, as far as I know, funding taken away from it. But for those of us who need a transplant, the cost of that is ginormous. Like, I think the last time I looked for an overseas transplant for stem cells to be brought over from another donor or someone that matches you in the United States, for example, is about $880,000 that the government will pay for. They have a certain reserve for those, because not everyone in this country donates their stem cells or will go onto a stem cell donor list. And so the government has to pay for those of us who need stem cells from another country. to have it brought over. So it's quite expensive. If more of us were putting our stem cells or our blood markers onto a donor list, which everyone can do through the blood bank, there would be less cost for the government. So there'd be more matches here in Australia. So yeah, having to have your stem cells or bone marrow brought over from another country is a very big process. Having a scientist fly over from another country with your life in their hands is a huge process. And very, very expensive. So there are little things that we can do as patients and consumers that can help the government to do all sorts of things and make the medical system a lot cheaper. And that's just one of them, is to go to your local blood bank and be a donor and put down your name for that. So that's the answer to that question for you.
Yeah, which is something which is a good reminder, I think, for all of us. Look, I'm conscious of time, so Amandeep, we might move on to the next statistic which we wanted to talk about, and that's around changing care expectations. So as you can see here, we've seen I mean, I think everyone knows this by now, but we've seen a massive explosion in telehealth in Australia, obviously fueled by COVID, but it's certainly a trend that is continuing. I mean, from Healthengine's perspective, what we typically see is people have a very strong preference to see their regular GP, and we certainly encourage that. But particularly after hours, or if it's for something just like a script renewal, those sort of things, people are increasingly embracing telehealth. What's your take on this? Are you seeing this with your patients?
Yeah, thanks, Dan. I'm particularly passionate about the telehealth space. Obviously, I've been working in and around sort of telehealth for the last 10 years, and it was really only COVID where it became sort of more mainstream. And I kind of wondered what it would take for people to realize the benefits of it. And some of the things that I have seen a huge benefit for me, because I work part-time in general practice, is that sometimes, for continuity of care, if I am not actually doing a session in the clinic, I could still see my patients virtually who maybe don't want to see another GP and explain their story all over again. And I can do that out of like my normal session hours, which maybe isn't great for my work-life balance, but it certainly works for my patients. And I think it works for the system, because it means that they're not wasting a lot of time having to retell their story, having to start all over again with a new GP, whereas it might take me 5 minutes to sort something out for them where I already know them really well. So there's been benefits around that. There is also benefits, I think, in terms of bringing back healthcare providers into the workforce. So, for example, one of my family members is a GP who went on maternity leave and wasn't planning to come back to face-to-face care for quite some time, but decided, when telehealth came around, that she could start seeing some patients, over some of her regular patients over telehealth still, from home until she could get back into the practice. So I think when we've got a workforce shortage, definitely it's helping to bring some clinicians back in. But from a patient perspective, absolutely think the patients get value out of being able to see practitioners, remotely. And I think this is everything from infection control, and particularly for our immunocompromised patients. And Jodie, I'd love to hear your opinion on this in a moment, but also just travel. I think in 2021 to 2022, it was estimated that the benefit of telehealth saved about $1.35 billion in travel costs for patients, because it is, and it's not just the travel, it's the time, it's the finding parking, it's the doctor's now running late, and then what you have to sit there for an hour trying to keep yourself busy, whereas at home you could be doing other things. So I think there's lots of benefits, and certainly from a continuity of care and being able to stay connected to your practitioners that aren't necessarily in the clinic every day, it's certainly helped from that perspective. But it would be great to hear, Jodie, your experience in using telehealth as a patient.
Over to you, Jodie.
Yeah, sure. Thanks. Telehealth is a national treasure that we don't really think about as much as we should. We don't use it as much as we should. And for those of us who are immunosuppressed, getting out of the house and being around groups of people can be a life-limiting thing. If you get anything, if you get a cold or you get, something that you don't need in your life in terms of a disease, you end up in hospital. So for those of us who are chronically ill or have illnesses that are difficult to treat or difficult to manage, particularly immunosuppressed people, telehealth is great. And also it just saves a lot of money with getting around and traveling all over the place. And you can get to the point. You can just say, look, this is what I need today. Most of us know that our doctors are really having trouble with, managing all sorts of complaints or things within a particular appointment. So we really need to, understand that telehealth is a great thing that we need to have, and that patients need to take care of it and have a go with it. Yep.
And David, what's your take? Are you in furious agreement with everybody here, or where do you see
it? Yeah, pretty much. A couple of comments. Patients love telehealth. Australian patients. We've just heard from Jodie why that is, and from Amandeep why that is. It's really good to see the growth of telehealth. As you'd know, this is part of a marketplace also for Healthengine, Dan. So you'd be probably aware that, it's a young industry. Despite the fact that Australians love it, one might be forgiven for thinking that governments don't like it. Certainly there is a need for positive regulation in telehealth. There is a need for better coordination of telehealth. We've got imbalances in the telehealth system. You can understand why they happen because, of course, you've got the bricks and mortar providers, and then you've got the online providers, online-only providers, and then some can attract Medicare rebates and some can't. And yet, despite that, in some cases, the ones that attract Medicare rebates are still more expensive than the ones that don't. I think it's an unlevel playing field at the moment, and I do think there's an important role for government to step in and be much stronger in positively regulating telehealth. I understand that part of the reason for that, attraction of rebates and otherwise is partly sheeted home to issues that the government's trying to control around quality. For example, the initial sort of regulatory approach of saying that a person can't receive a telehealth consultation unless they have actually been seen face to face. But that's actually a fairly blunt and inappropriate way to resolve the broader issues around telehealth. And I do think some different approaches are needed. It's critically important for people in regional, rural, and remote Australia. It's a godsend for many people who would otherwise have very little chance at all of seeing a GP, and now can do so in a relatively easy manner. There's, of course, limitations to telehealth for the practitioner and the patient, but as long as they're well understood and managed, then telehealth has got a really, really big future in healthcare in Australia in primary care. And I think we should be supporting it and looking how to make that happen in a controlled and well-regulated way.
Just picking up on that last point, because we hear mixed things from our customers about telehealth. I think broadly, most, if not all, would agree with the sentiment of the three of you. But picking up on that point around limitations, Dave, some GPs are more concerned than others about the limitations of this. Amanda, I might just quickly throw back to you, if you don't mind. How significant a problem is that for people that are accessing care either over the phone or via video conference?
Look, I think there are certainly GPs out there who are more embracing of telehealth with their regular patients, and others who post-COVID kind of went back to, back to how things were before and come in to see me in person. And I find that a bit of a shame, because I think we did all the work, we did the upskilling, we learned how to use the technology, we helped educate patients, we brought them on the journey, and then we kind of went, oh, okay, now let's go back to the 2020s. And that does make me a little bit sad, because I think we should really have used that as an impetus to grow and develop this sector. And I think completely to your point, David, I agree. I think it's relatively immature, even though we've been doing telehealth since, the RFDS has been doing it since the 1920s. It's been around forever. But I still feel like it is a bit of an immature market, where we've got really great accreditation processes and things for clinics and hospitals and, in-person care. And we need to translate that to what does that mean for virtual care, and how are we making sure that same quality and standards of care are applied to that sector as well, so that patients, no matter how they access care across Australia, doesn't matter what the format is, that the same quality of care is upheld, and the practitioners are held to the same standard. So I think there's still a bit of work to be done in understanding how we translate that from in-person care to virtual care. But it would be nice to see practitioners also embracing that. And maybe part of it is, you know, it might be working out what the reimbursement models are. As you said, David, that, you know, there's still some, you know, rules and regulations around that. But it may also be from a technology perspective, are we making it easy for people to do, you know, video calls within their current systems, or is it like they have to go and log on to something else and they don't have the necessary infrastructure? So there's a bunch of things that we need to explore to say, what is the barrier? What's stopping them from really truly embracing this? Because it's certainly not the patients. The patients are asking for it and they're willing and they're very, very capable. I think it's really our job to work out what's stopping us on our end.
And at the risk of a shameless plug, there is technology that can help with that, which we might be able to help with. But I'll move on swiftly.
Dan, could I make just a quick further comment? You know, I think it's really important with telehealth that we understand what it does do and what it doesn't do, not try to focus on making it something that it isn't. It is a virtual connection with somebody. It's not face-to-face. There are limitations to that. There are many ways in which further technology is going to be able to aid in the delivery of telehealth services in a more direct way that covers some of those problems of not being sitting across a table from somebody. But there's also the role of the GP as a communicator and engaging with the person. And as good as this is and the way we do webinars today, it's not quite the same as being in a room together, and it never will be. Because there are a lot of things that you pick up in terms of just understanding where people are at, their mood, their how they feel about certain things with very, very subtle body language. The GPs are extremely skilled at picking up, much harder on this environment. But I think over time we need to be able to try and address some of the technological challenges there, not make it what it isn't, but work through that. During COVID, I had high blood pressure. I was taking my blood pressure, and it was particularly high. So I had a telehealth consultation, reported my blood pressure, and I had my blood pressure medication changed. But in fact, it was the monitor I was using that wasn't properly calibrated.
Oh, really?
And so the GP never got an opportunity to take my blood pressure with a tool they could trust. And so that took a bit of undoing. There's always going to be technological issues, but as long as we just accept it for what it is, which is a critical part of the healthcare system and primary care, but not all of it, then I think we can go a long way with telehealth.
Yeah, agreed. Okay, so look, final stat, folks, and then we'll come close to finishing up. I'll just share my screen one last time. Look, we have touched on this, so it's probably not a surprising statistic, but we have seen that 50% of the patients that we surveyed for this report had visited a GP that bulk billed in the last 12 months. And, you know, from our perspective at Healthengine, we're also seeing searches. I mean, I guess consistent with what we've been talking about today, searches for bulk billing GPs have been consistently increasing with us over time. I think it's just under 50% of searches on our services are for that now. Look, Amandeep, I might go back to you again just to give you your thoughts on this. I know we have touched on it, but how important is bulk billing for GPs? You mentioned that there's obviously been cost of living or cost pressures on GP practices as well as on patients. What's your take on this?
Yeah, look, it is a challenge. Look, I don't think, as I mentioned before, any of the GPs like having patients feel like they're out of pocket, and that's going up, and that's what's stopping them from going to see a GP. But as David mentioned earlier, I don't know how practices manage to do full bulk billing and run, because it is difficult to make that sustainable. And the only way you can really do it is through volume. So, you know, the more patients you see, you know, the more likely it is that, you know, you can get away with, I guess, bulk billing covering all of your costs. The risk with that is that you're not actually providing necessarily, you know, the care that you want to provide, because you don't have that time with the patient. And often I find that patients will come in with one thing and they'll say, look, I'm feeling tired. And you can just say, here's a blood test, go and check your iron levels and get them out the door in 5 minutes. Or you can sit down and start talking to them and realize they're actually depressed or they're anxious, they've been feeling suicidal, and you're actually faced with a patient who's got a major depressive disorder that you need to manage. And you don't find that out in 5 minutes. You know, that's a conversation that could take at least half hour to build up that rapport and have those patients feel like they can trust you and open up to you. And that's the kind of, like, in medicine, we call it sort of slow medicine. Like, we actually really enjoy the slow medicine part, which is not us taking our time because we want to, but it's being able to really spend quality time gathering patient history and being able to diagnose and do all the great things that we were taught to do during our training. And that's why we're seeing a lot of these GPs wanting to go back to models where their work isn't tied up to volume and percentage billing, and, you know, they're just sort of churning through patients. So we've got to think about, how do we structure a system that allows the GPs to provide that kind of care, the patients to receive that kind of care, actually feel listened to, actually feel like they're getting value out of a consultation, and it not just become this volume driven thing. And I think one of the things I really want to focus on is the quality of the care that we're providing rather than the volume of care, because we know that not every interaction with the healthcare system is necessarily an interaction that has a positive impact on the patient's healthcare experience and journey and outcomes. But how do we measure that when we don't have the data, where we don't know what was the outcome for the patient by having that healthcare interaction? And this is why I love the space of technology, because I think so much of this could be potentially solved if we had access to data and we actually understood what are the things we should be investing in and what are the things that are not adding any value, where we can use our healthcare providers better, we can give our patients a better experience, and we can actually fundamentally save money, because, you know, at the end of the day, we've got to think about this from a, you know, fiscal perspective. But you know, as we mentioned before, we can save those hospital admissions if we invest in primary care, but in good quality primary care, not just high throughput and not necessarily good value.
This is, by the way, this, sorry to interrupt. This is something which we hear of a lot, by the way, is you know, the ability for patients to be able to share their data between providers and the inefficiency that comes from the difficulty of that. Jodie, you're nodding. I'm assuming that was a big part of your journey. What can you tell us?
Well, you know, if a patient can't afford to go to a GP that is someone that they see on a regular basis, then bulk billing is probably the best thing for them. But for me, because my situation was so chronic and so difficult, going to see a GP regularly, the same one over and over and over, provides you with the best care possible, because obviously they know your history, they know everything about you. So I would encourage patients always to try to go to a regular GP that is aware of their background, their history, and what they've been through, because that's the way you're going to get a better treatment and better continuation in care. But also, you know, for patients who are struggling financially and are struggling in different areas, if you can't go to a GP only because of bulk billing, and bulk billing is the only way you can see a GP, then you should do that. I mean, really, that's better than not going at all.
Dave, we've had a question come in which is related to this, and that is, again, a topic which gets a lot of coverage in the media, and that is the limited or the lack of government support for dental treatments. Do you have a take on that from the Patient Association's point of view?
Well, it's a strange thing, dental, isn't it? At some point in the horse trading process a number of years ago, despite review and recommendation to the contrary, the decision was taken not to roll dental into Medicare. And from that moment forward, we've had a system which has been problematic. Now, you can sheet that home to more reasons than just that, but it's an unusual thing. It's an important form of healthcare. It keeps Australians safe and well. And it's a very, very expensive form of healthcare, and the data of our reports shows the decisions people are making to delay not only their own treatments, and especially in young families, adults delaying their or not taking their own dental treatment in order to afford getting their kids treated or their teenagers treated. But there's a really important underlying set of problems there. Now, there's been reports written by the Grattan Institute which propose ways to address that. I won't go into it in detail now, but I do think that it's an important part of what I'd call an overall appetite for reform, which is needed in this country. And my observation about healthcare reform at the moment, in my view, is that governments do not have strong reform agendas, and they haven't had for some time. What we've had is the diminishing of the control of governments over the healthcare system as they move from provider to funder to purchaser, and the rise of the stakeholders who sit around a large round table, point to their left and blame shift all around the table, so that we really struggle to be able to implement significant reforms because of the pushback from the players who feel that they might lose from those reforms. When it comes to the issue of bulk billing and the like, we're talking about a big issue. And it's not just a case of throwing money at it. We can't just say, well, the cost of primary healthcare is so much more now, therefore we need to throw those extra billions at it. I think there's a whole range of issues. I mean, doctors are the people, GPs are the people who keep us safe and well in this country. They do extraordinary work as a profession, and they're generally filled with extraordinary people who do really important work, public service effectively. They're also professionals. They also need an income. And there's also a tremendous amount of Medicare rotting in the system. The question is how many billion, depending on which report you read. And yet there's a pushback against wanting to reform even that, where significant money can be saved. We certainly need to increase the Medicare rebate, but going to Amandeep's bigger question, I think there's an open question about how far we're prepared to go in reform. And I think we need to take a step back and, as a country, consider taking on larger scale reforms, because maybe general practice would really benefit from an outcomes-focused approach, which is the quality issue that Amandeep's talking about. What is the actual outcome and value of the interaction with the GP? I think there are a lot of people in primary care who'd be very happy, as Amandeep has suggested, to potentially go down that pathway. So we really need to go back and ask the question about the funding model itself, rather than just throwing more money at these things. And in order to do that, we all need to share an appetite for reform.
It's difficult though, isn't it? Because I think everyone would agree that quality of care is hugely important and typically takes time, but it does run to some extent in opposition with the system that we have in place now, and also the demands on that system where we've got, it's already hard enough to go and to get in to see your GP. And so moving to something which is potentially going to be more time consuming, while it will no doubt have better long-term results, it's going to take a pretty significant reform of the system for that to happen. Are there any final observations from you, Amandeep, on that point, or anything else before we finish up? And I'll throw to you as well, Jodie.
Yeah, I mean, I guess I just don't want it to all end on doom and gloom. I do want to say that I spend a lot of time overseas and in other health systems. I have a father who has to use the NHS in the UK to get his healthcare, and despite numerous attempts at getting me to move back to the UK, I would never go, because I love being a GP in Australia. And I think that I'm not saying that we should measure ourselves with, the worst examples out there, but I do think that we have a lot going for us. And I think it's great that we've recognized some of the challenges that are going to come up against us in the next sort of 10 years, because this is potentially going to get worse if we don't sort of change some of our thinking. But I want to say that we also do have a world-class health system. We just need to protect it and keep it that way, because that's the reason why so many of us love living here. We all move here, and I'd say that we've got the building blocks there. We just need to do a bit of adjusting of how the system is, the most efficient for all of the demand that we're going to expect over the next decades to come.
And Jodie, any final observations from you?
Yeah, so I just want to encourage patients who are listening that it's not good to take your own medical care into your own hands. So make sure that you are going to your doctor as often as you can. If you have to borrow money, then borrow money. It's not something that you should be worried about or, be concerned about. It's an important part of your quality of life. You need to have as a patient, you need to have the best care you can possibly have. And skipping appointments is going to cause you harm and your family harm in the long run. And also, I like to say to patients to think of their doctors as human beings also. I think we sometimes push our doctors a little bit too hard, and we don't think about the pressures that they come under. And so I like to encourage patients to, if you need a long consultation, then please take a long consultation so you can get all those things done during your appointment, and you're not pushing your doctor in a 10-minute appointment to deal with 10 different things. I think these are important, respectful things to do for our doctors. We need to think of them as, they're working so hard. So let's support them, and let's support our families by looking after ourselves properly. Even if we have to borrow a bit of money to go to the doctor, that's something we need to do. And so, I've been through a really difficult time with medical delays, and I know what it's like to go through enormous pain and not have anyone listening to you. So it's important to make sure you have the best doctors possible listening to your symptoms and requests.
I think that's a really fantastic message for us to finish on. But David, it looks like you did say want to make one last point. Do you want to sneak in there?
Yeah, look, I just wanted to underline what Jodie said, but also put it this way. We say that we want a system where Jodie and others don't have to borrow money to see a doctor. And that this is a more than $100 billion industry, an endeavour by this country, and taxpayers pay for more than that. And I think the people running it have been tweaking it as the decline has continued. And that's why I'd suggest again, we need to take a deep breath and think about reform in the bigger picture.
And on that note, we will wind this up. Folks, thanks very much to everyone who's participated today. Thanks very much also to our panelists, to Jodie, Amandeep and David. And look, a special thanks from my perspective to the Australian Patients Association as well for collaborating with us on this report. I think we've seen that and I think this conversation has demonstrated that it's a really important contribution to the national conversation around healthcare. I take your point, Amandeep. It is always good to remind Australians about how fortunate we are to live in this country with the healthcare system that we have. But that doesn't mean we shouldn't always be striving to make it better. So perhaps we'll finish on that. Thank you again to everyone for joining us today, and look forward to the next one.